Welcome to Talk 4. This talk covers two organ systems where toxic injury can kill in minutes: the nervous system and the cardiovascular system. The brain controls everything. The heart keeps blood moving. When toxins disrupt either of these systems, you are managing a rapidly evolving emergency. The goal of this talk is not to memorize a list of toxins, it's to recognize the clinical syndromes, the toxidromes, and connect them to mechanism so you can reason toward treatment even in unfamiliar situations. Let's get to it. The concept of a toxidrome, a toxic syndrome, is one of the most clinically useful frameworks in toxicology. You don't always know what the animal ate, but if you recognize the pattern of signs, you can narrow your differential and begin empirical management immediately. Let's walk through the big ones. Cholinergic toxidrome, SLUD. This stands for salivation, lacrimation, urination, defecation. The animal is pouring secretions from every orifice. And in meiosis, small pupils, bradycardia, bronchoconstriction, and muscle fasciculations, and you've got full cholinergic crisis. This is organophosphate territory. The mechanism, inhibition of acetylcholinesterase, leading to acetylcholine accumulating, leading to overstimulation of muscarinic and nicotinic receptors. Treatment, atropine. Large doses, titrate to drying secretions, not to heart rate. And praloxime, if given before ACHE, is irreversibly bound. Anticholinergic toxidrome, the opposite. Think of the mnemonic: hot as a hair, dry as a bone, blind as a bat, mad as a hatter. Hyperthermia, dry mucous membranes, mydriasis, and altered mentation. Jimsonweed, deuterostramonium is a classic cause. Diphenylhydramine overdose fits this picture. Sympathomimetic, the amphetamine picture. Everything is ramped up. Tachycardia, hypertension, hyperthermia, agitation, mydriasis. We see this with amphetamines, pseudoephedrine and cold medications, and illicit stimulants. CNS depressant, sedation, ataxia, respiratory depression, opioids, benzodiazepines, barbiturates, ethanol, cannabis. The risk is respiratory failure and aspiration. Serotonin syndrome, a clinical triad: hyperthermia, neuromuscular abnormalities, tremors, clonus, hyperreflexia, and altered mentation or agitation. This can be life-threatening, caused by excess serotonergic activity, seen with 5-HTP, tramadol, SSRIs, certain antidepressants. Treatment, cyproheptadine, a serotonin antagonist. Supportive care, manage the hyperthermia aggressively. Focus on the excitatory CNS toxins, the ones that make the nervous system fire uncontrollably. Look at the graph. A normal action potential fires once and resets. A neuron exposed to a sodium channel toxin, like a pyrethroid, fires repetitively without stopping. That's what you see clinically: tremors, fasciculations, seizures. Organophosphates and carbamates are the most common cause of life-threatening neurotoxicity in veterinary practice worldwide. Acetylcholinesterase inhibition lets acetylcholine pile up at synapses. You get the cholinergic SLUD signs plus nicotinic effects, muscle tremors, fasciculations, and in severe cases, respiratory muscle paralysis. Treatment is atropine, and lots of it. The atropine dose for organophosphate toxicosis is much higher than the standard cardiac dose. You titrate to drying of secretions and resolution of bronchoconstriction. Praloxime regenerates acetylcholinesterase if given before the organophosphate enzyme bond ages. There's a time window, typically within 24 to 48 hours, depending on the compound. Pyrethrins and pyrethroids. These are commonly used in veterinary flea and tick products. They keep sodium channels open, causing repetitive neuronal firing. Cats are highly sensitive. They lack the enzymes to detoxify pyrethroids efficiently, and grooming leads to significant oral exposure. The important distinction: pyrethrin toxicosis in cats is not treated with atropine. There is no cholinergic component. Treatment is bathing to remove the toxin, methocarbamol for muscle tremors, and supportive care. Metaldehyde, or slug bait, very accessible. Dogs find it palatable. Within an hour, violent muscle tremors progressing to generalized seizures and extreme hyperthermia. The combination of seizures and hyperthermia is called the shake and bake toxidrome. Hyperthermia is the killer. Active cooling is essential. Control seizures with diazepam, manage the temperature. Strychnine and penetrim A. Less common, but important to recognize. Strychnine classically causes stimulus-sensitive tetanic seizures. The animal convulses when touched or when there is a sudden sound. The other side, CNS depressants. These slow the nervous system down, and the primary risk is respiratory depression and airway loss. Opioids. Cannabis exposure has massively increased in the past few years as legalization has spread. We see dogs ingesting edibles, concentrates, and plant material. THC is a psychoactive compound. It's highly lipophilic, distributes widely into fat, so elimination is slow. Clinical signs: wobbling ataxia, dilated pupils, urinary dribbling, vomiting, hypersalivation, and varying degrees of sedation. Treatment is supportive. There's no specific antidote for THC in veterinary medicine. The signs are protracted, but the prognosis is generally good with supportive care. For actual opioids, think of a legal drug ingestion or a prescription opioid left within reach. The classic triad: meiosis, CNS depression, respiratory depression. The reversal agent is naloxone, an opioid receptor antagonist. It works dramatically and quickly, but it's short-acting. You may need to repeat doses or a constant rate infusion because the opioid may outlast the reversal agent. Benzodiazepines potentiate GABA-A signaling. They make inhibitory neurotransmission more efficient. The result is sedation and ataxia, rarely fatal on their own in dogs and cats, but dangerous if combined with other CNS depressants or in compromised patients. Flumazenil reverses benzodiazepine effects, also short-acting. Barbiturates are more dangerous. They directly open GABA-A chloride channels at high doses, causing profound CNS and respiratory depression. Management is airway support, ventilation if needed, and waiting for metabolism. Phenobarbital, used therapeutically in epileptic dogs, can cause toxicosis at high doses or with impaired hepatic clearance. Ethanol and isopropanol cause CNS depression, hypothermia, and in small animals, profound hypoglycemia. Always check blood glucose. Cardiovascular toxicology is where the stakes are highest and the timeline is shortest. Arrhythmias kill fast. Let's start with cardiac glycosides. These are found in several common plants: foxglove, digitalis, oleander, lily of the valley, and the skin secretions of bufo toads. The mechanism: they block the sodium-potassium ATPase pump, which is how cardiac cells maintain their membrane potential. When this pump fails, intracellular sodium rises, which activates the sodium-calcium exchanger in reverse, flooding the cell with calcium. Excess calcium leads to arrhythmias. The spectrum includes bradycardia, AV block, and life-threatening ventricular tachycardia and fibrillation. Treatment: digoxin-specific antibody fragments, FAB if available. These bind and neutralize the glycoside. Otherwise, treat arrhythmias, correct electrolyte abnormalities, especially potassium. Hyperkalemia from pump failure worsens toxicity, and support the heart. Look at the ECG schematic. Normal rhythm, evenly spaced. Bradyarrhythmia, wide-spaced, slow. Tachyarrhythmia, rapid, irregular. Each pattern points towards a different toxin class. Ionophores in horses. We touched on this in Talk 1 as a species difference. Menicin and lazulacid are ionophores used in cattle and poultry to promote feed efficiency. Horses are exquisitely sensitive. Even small amounts cause mitochondrial uncoupling in cardiac and skeletal muscle cells. Those cells can't make ATP and they die. The heart fails. There is no antidote. Treatment is supportive. Horses that survive ionophore toxicosis often have permanent cardiac damage and cannot return to athletic activity. Sympathomimetics drive cardiac rate up, tachycardia, and ventricular arrhythmias. Hypertension can cause end organ damage. In severe cases, beta blockers may be needed, but carefully, because unopposed alpha activity can worsen hypertension. Organophosphates affect the heart too, through muscarinic stimulation, causing bradycardia. Atropine addresses both the secretory overload and the cardiac effects. This slide is your quick reference antidote table. Let's walk through the key points. Organophosphates. Atropine is your first-line drug. Give it in high doses. The goal is drying secretions and relieving bronchospasm, not just hitting a target heart rate. Pralidoxime works by regenerating acetylcholinesterase. It physically breaks the bond between the organophosphate and the enzyme, but only before aging occurs. Aging is the process by which that bond becomes permanent and irreversible. Get pralidoxime in early. Opioids. Naloxone is a beautiful reversal agent. Give IV, watch the animal dramatically improve within minutes. But remember, naloxone is short-acting, often 20 to 60 minutes. Many opioids last much longer. Your patient can wake up, walk around, and then resedate when the naloxone wears off. Always monitor and be prepared to redose. Acetaminophen and acetylcysteine. Give it early and often. It replenishes glutathione stores, which are being depleted by NAPQI. IV formulation preferred. Ethylene glycol, fameprazole in dogs. Works beautifully if given early. In cats, fameprazole must be given within 3 hours. Ethanol can be used as a substitute. It competes for alcohol dehydrogenase, but blood alcohol monitoring and precise dosing are needed. Vitamin K antagonist rodenticides. This category includes the long-acting anticoagulant rodenticides like brodifacoum. They deplete vitamin K-dependent clotting factors. Treatment is vitamin K1, not K3. Duration of treatment is typically 4 to 6 weeks for long-acting compounds. Always verify coagulation status before stopping vitamin K. Methemoglobin. Methylene blue works well in dogs. It acts as an electron carrier, reducing methemoglobin back to functional hemoglobin. In cats, methylene blue is contraindicated. It causes Heinz body formation. Use ascorbic acid instead. Know these cold. They save lives.